Good afternoon, advocates. Thank you so much for joining us today. This is our 5th episode of our Alzheimer's Advocacy Academy. Today's episode will cover leading or participating in community events. I am Nicole Dalsky, the California Government Affairs Manager, and today we're being joined by advocates from across 4 states, including Arizona, California, Hawaii, and Nevada. We have ambassadors, ACT members, and Alzheimer's state champions. And as always, we are so incredibly grateful for your time and hope that you find today's episode helpful and engaging. Before I introduce our presenter, I'd like to introduce real quickly our public policy and advocacy team. Susan DeMorris out of California, Jared Giaroso, also out of California, Ian Ross, James Fitzpatrick from Arizona, Ian Ross, he's from Hawaii, Jessica Rothar, also from California, Daniel Gaitan, and Josh Bohannon, both from California as well. Just a quick reminder, housekeeping item, for any Q&A throughout the presentation today, please use the chat feature to enter your question. If you happen to use the Q&A feature, that's fine. We've had a few glitches in the past where we're not able to read everyone's, but we do have some backup today. Kate Johnson from our home office, so hopefully if you submit any questions, we're able to capture those. But the best way to submit those is through the chat feature at the bottom of your screen. So with that said, I will now pass it over to today's presenter, Director of Public Policy for Northern California and Northern Nevada Chapter, Susan DeMorris. Welcome, Susan.
Thank you, Nicole, and hello, everybody. Thanks for joining today. And Nicole, thank you for everything you've done to get us to this place so that we can offer this episode to all of you today. I'm so excited about the lineup we have for you. I'm going to tell you a little bit about our presenters in the order that they'll be appearing, and then we'll start off with Kate. So we're so fortunate in the association to have Kate Johnson working with us in our Washington, D.C. office, heading up our advocacy program. Kate joined us almost 7 months ago from Autism Speaks, and before that, she had worked on Capitol Hill. She's just doing a fantastic job and really giving us some great new ideas and energy and creativity that she's picked up along the way prior to joining the association. And Mark asked her before we started, she, like so many of us, also has a personal family connection to the disease. Following Kate, we'll be hearing from Barbara Marquez. Barbara's an ambassador, a board member, fairly recently retired public health professional, and Barbara honors her mom, Florence, in her advocacy. We'll be followed by Carolyn Polchow from Southern California, also an ambassador. She found her way to the association as a walk volunteer, and she's one of the COVID heroes. She's a teacher teaching online high school right now. In fact, she's really teaching right now. She's going to join us at 12:20 when she gets a break in her class. And she honors her mom, Catherine Moore, who is in the advanced stages of Alzheimer's today. And then our wrap-up and closing presenter will be Mark White, also an ambassador and a member of the Capitol Response Team in California. Mark is a very active retiree. And Mark advocates on behalf of his wife, Carol. So those are our speakers. We're going to hear from Kate, Barbara, Carolyn, and Mark, and then we're going to open it up to all of you for questions. Along the way, if you have any questions from any of our speakers, just go ahead and put them, as Nicole said, in the chat box, and we'll make sure that we get to all the questions at the end. We've allowed about 20 minutes at the end for questions. So with that, we will start with Kate. Kate, welcome from Washington, D.C.
Hello, everyone, and thank you so much for having me. Not only thank you for having me, but thank you so much for being a part of the association, for volunteering with us, and being one of our advocates. I will hopefully try to say thank you as many times as I can during my quick little presentation for you today. But we're really grateful for all of your hard work, and all of the success that we ever have is thanks to you guys and everything that you do there on the ground. So thank you for joining us. I'm so happy to virtually meet you, and I'm so glad you're here. So I'm going to start today by giving a brief update on what's been happening in Washington, D.C. There has been a lot of changes and a lot of movement over the last few weeks, and I know it can be a little overwhelming. So I want to just cover some of our some things that Congress has been discussing and what our big priorities are right now. So a first quick update, the Senate is back in D.C. this week. The House is still back in the districts, but we've heard rumblings that they'll be coming back in the next couple of weeks. We're not sure exactly when, but that doesn't mean that they are off and on vacation. They're still working, so it's really important to continue communication with your members of Congress during this time. Our current congressional priorities, first is to we call it the Elder Abuse Act, but it's the formal name is Promoting Alzheimer's Awareness to Prevent Elder Abuse Act. And this would require the Department of Justice to develop training materials to assist professionals who support victims of abuse living with Alzheimer's and other dementia. The next big priority right now we're working on, which I'm sure a lot of you are familiar with, is the Improving Hope for Alzheimer's Act. The bill numbers for that, if you really want that, if you like to take note of the bill numbers, or you want to jot it down if you've got a pen and paper, it's S880 for the Senate version and HR 1873 for the House of Representatives version. And this bill works to educate clinicians on care planning services available through Medicare. The next big priority right now that we're working on is expanding access to credit for nonprofits, or I'm sure you've seen the hashtag relief for charities. This would extend support for nonprofits that have 500 to 10,000 employees, which is the association. We have a little over, I think, 2,000 employees. So we didn't fall in the last category when they passed the last relief bill. That was only for employees under 500. So we're advocating for that to expand to bigger nonprofits as well. And then finally, some of you might have heard about this effort that we're doing, but we're doing a very targeted House appropriations push right now. If your U.S. House member serves on the House Appropriations Committee, you should have gotten an email from our team with next steps about this effort. If you do have a U.S. House member who serves on that committee, and you did not get an email from our team, feel free to reach out to us, or I'm sure Susan or Nicole can help you with anything that you could need. Now, moving on, one big question that we've been getting a lot is, how can I make an impact during this time? What are some virtual opportunities that I can use to connect with my legislator? This is different. It's not like you can just schedule an in-person meeting and waltz into a district office where everyone has had to shift to this online environment. And we wanted to talk about what's really been working across the country and some tactics that you can kind of take with you to increase that engagement with your legislator. So of course, social media, as always, is a great way to connect. And especially now, we've seen that a lot of members have been utilizing social media to try to connect with their constituents, but Facebook, Instagram, and Twitter are the core three that we see members utilizing at this time. Of course, as always, direct phone calls and direct email outreach are another great opportunity to connect. If you do have a contact in the office, reaching out to them directly and not necessarily going through the general inbox has been a better strategy, but we have seen response rates being pretty good through general email inquiries at this time. I think staff understand that there are a lot of questions and a lot of confusion going around at this time, so that they know that they have to be a little bit more responsive and at the ready. Another opportunity is virtual meetings. I'm sure some of you have already done this with your legislators, either at the state or federal level, but some offices are partaking in virtual meetings over maybe Zoom or Blue Jeans, just like we're on today. It's a great way for them to see us face to face. It's as close we can get to an in-person meeting at this time. So once again, always ask the office if they're comfortable with this, but it could be a good opportunity to make that, as close we can get to a face-to-face connection as we can. Story sharing, we are doing a story sharing campaign, and we'll talk more about this in the next couple of weeks. But anytime that you can share your story with your legislator, tag them on social media, record a video talking about your experiences or why you advocate and why it's important to support this legislation. I know that might sound cheesy. You guys might think, I'm not, a movie star. I don't want to get in front of a camera. But those videos and that opportunity to share your story with a legislator is really important. If you've been to the advocacy forum before, it's one of the things that we talk about quite often, how sharing your story can create a really big impact and really change the course of a legislator's opinion on not only our bills, but on our cause forever. A lot of our congressional champions don't even have a direct connection to Alzheimer's. I don't want to say a lot, but there are some of them that are champions just because they've heard a really touching story from an advocate or a constituent in their district. Of course, media opportunities, letters to the editors, any type of story that you can work with your local media or news outlets is effective at this time. Of course, they're covering COVID issues. It's incredibly important, but some outlets are looking for other stories to cover as well. So this might be a good time to indirectly reach out to your legislator through the media. And then finally, teletown hall and virtual town halls. I'm sure you guys have seen an uptick in your members' participation in teletown halls, so them hosting or looking to host with our community. I know California has been doing an awesome job connecting with legislators all over the state and working with them to try to make sure that constituents and advocates can get the information that's needed. But, there's always an opportunity to ask questions at other teletown halls that congressional offices are hosting. And I highly encourage, if you hear of a teletown hall that's coming up through your member of Congress or state legislator, talk to Susan, talk to Nicole, talk to your public policy team, and try to come up with a game plan about what type of questions you can ask and what you can do to make sure that they are talking about Alzheimer's and that we can bring it to the forefront. So a couple of tips that we've found. I don't know if how many of you guys are ambassadors, but I did a poll in our Facebook group just yesterday talking about what has been working at this time. That's been probably the number one question we've been getting from advocates is what's working, what do you recommend for ways to connect, and what pieces of advice do you have for us? Once again, this is a strange time. I know you guys have heard that. I know you're experiencing it at home. But here are some tips that I can give you from across the country that we've noted that have been working really well. So my first tip is to ask the office of what communication works best for them. Every office is different. Some may prefer direct emails. Some may prefer a phone call. Some might really maybe the member really loves virtual meetings. Others don't really like virtual meetings right now. So I think having an open conversation and asking them what works for them and what they're comfortable with is a really, really great step in that process. It also shows that we're flexible and we want to work with them, not yell at them or get frustrated with them. We're here to be their partner and be almost a teammate for both of our efforts. My next tip is don't underestimate your office. I know that most offices are very overwhelmed at this time, but a lot of them, if not all of them, are really looking for ways to connect with their constituents, and you as a constituent are who they want to connect with. So if you are, if you're talking to them and you come up with an idea of a, virtual coffee with Congress or a virtual event, they might be really, really excited about that opportunity. I think a lot of us are nervous to throw out those ideas because we know that they're really overwhelmed and they have a lot going on. But you might be surprised that they might want that opportunity to connect with our community and get the word out and just kind of further learn what we are interested in and what issues are important to us. Next, I'm going to talk in a second about some studies that have been going around about best ways to communicate, but we've seen just from our experience here in DC that personalized emails and direct phone calls seem to be working the best. But once again, each office is unique. So make sure to communicate with them to figure out what works best for them. But if you're getting started, maybe you've stayed off for a couple weeks because you wanted them to get their bearings in this crisis, it might help to start with that direct email or direct phone call, something that's personalized and to a direct person, not just to a general inbox. And then I know this is cheesy. If you know me, if you've heard me speak before, you know I'm a cheese ball with this stuff, but always make sure to lead with kindness. Telling them thank you for their hard work or simply asking if the staffer is okay can go a really, really long way. They are bombarded with a lot of negative and intense emails at this time. So taking a moment to say thank you and just being kind and being understanding can go a really long way. The final question that we've been getting is it appropriate to reach out to congressional offices right now? And I don't want to take up too much time, but I want to quickly go through some survey results that the Congressional Management Foundation found. They surveyed congressional staff in March, so while this crisis was going on, about what they want to hear. And I'm just going to go over a couple of the highlights. 81% of staffers said that personalized email messages from constituents are the most effective way to communicate at this time. And 65% say a direct phone call works as well too. During this crisis, when asked what issues should constituent groups or advocates engage, 96% said that they are heavily focused on issues directly and indirectly related to COVID, which we knew or we assumed. But what surprised me was 79% also said that they are open to other issues as well that aren't directly related to COVID. So keep that in mind when you're communicating with them. Like I said, don't always underestimate them that they only want to hear about COVID. If they tell you that they only want to hear about COVID, then yes, they only want to hear about COVID-related issues. But I think that is something that was interesting to me. And then finally, over 98%, so close to 99%, reported that they are fully able to conduct all of their work from home while they're teleworking or in their home office. So I don't want you to think that just because we're in a weird time that they are unable to complete their tasks or that they are not around. They are, and they want to hear from you. If you have any other questions, I'm going to be around in the chat and I'm happy to give you more information. Thank you to Susan and Nicole for having me. Thank you to our other panelists who are amazing, awesome advocates, and I know you guys will learn a lot from them.
And now we will hear from our first volunteer advocate. We'll hear from Barbara Marquez. And thank you, Kate. Thank you so much. Barbara, you're on.
Yes, thanks, Kate. Good advice to all of us. And thank you for the opportunity to share a little bit about what Team Bear has been doing here in Sacramento. Team Bear is what I refer to as the team of volunteers with the Alzheimer's Association working with Congressman Ami Bera, who also happens to be a physician. And I think that plays into a little bit about what I'm going to talk about today, our annual Brain Health Forum. So this is definitely a partnership with Congressman Bera, who represents the 7th District here in California. We wanted to, I actually reached out to their office this morning with a personalized email and got a pretty quick response back from Phil Norton, who is his aide. And we've been very fortunate because Phil's been been a consistency in our 4 or 5 year adventure with the congressman on the Brain Health Forum. And I asked Phil a little bit about, I shared with him that I was going to be presenting to this group of folks from the 4-state region and sharing a little bit about what we've been doing. And I said, what would the congressman want to share with everybody who's on the line today as you try to work more effectively with your congresspeople? He said that the congressman speaks very highly of this effort, this event, this annual event. And he said that the things that stand out are it's a collaborative effort, truly a partnership, and that's why I put partnership on here. And he says that often that we come together as a community in this event to raise awareness about Alzheimer's and associated resources, as well as to help one another, that it's truly, some of it is peer-to-peer, and that, bringing community together, we share what's worked for us, and this is an opportunity, this opportunity that we present annually is one to get to know your neighbors and also know a little bit more about the resources that are available. And all this work is done as we continue to research for a cure. So he's also been a very strong proponent of federal legislation to do something. Okay. So what I want to share with you is a little bit about what the forum is actually like. So we've been doing this for 4 years. This would be our 5th year, and I'm going to tell you a little bit about what our plans are for this year given the COVID situation. But the forums basically have some standard features. They get modified each year and enhanced, I like to say, as we learn from each event and how to make it even better. There's some standard features. One is that it's all volunteer driven. So we have a really great team. We have about 10, 12 core people on our team. So we're very fortunate to have an active group. And we take on responsibilities for organizing and recruiting speakers, the topics, what do we think all of our neighbors want to hear about. We also do the promotion along with also support from the Alzheimer's Association and also the Congressman's office. We take responsibility for sign-in, the refreshment setup, the chair setup, and also the cleanup. So we do it all. And it also gives us a wonderful opportunity to do team building. So we do our regular meetings, our advocacy meetings before the forum and such, and after the forum, and in between. But this is one where we really have hands-on, and we really build on the assets and the skills that the team brings. It's low cost. We look for venues that have no fee to them or a very small fee, and then we get on our knees and beg, please, this is a really great event, and we want to bring it to your setting and into your community, and we've gotten great cooperation there. We've had the forums held at library rooms, park and rec centers, community centers, at a church once, and last year at a senior center. And then one of the other features is that every year we move it to a different portion or a different section of the Congressman's district. The Congressman has a pretty large district because it also encompasses some of the rural portions of Sacramento County. So it goes all the way from the south of the county all the way to the north of the county, which is about 45 miles, 50 miles in length. But given the congestion that's typically around Sacramento area, it can take more than an hour to go from one area to the other. And we know that that can be a barrier to many people. So one of the things that we like best about the forum is that we move it to different neighborhoods so that every year we give another kind of section of the district or the community an opportunity to go to a familiar place. And that's why we've moved it around to different settings as well. All on the recommendations of people who live in that setting who are part of our team. We have a standard format. It's usually in the morning from 9 to 11:30, and we serve light refreshments. We end at 11:30 because that avoids the need to provide a lunch, which would take us out of the free and no cost kind of event. We don't require a lot of registration. There are not a lot of registration requirements, but this format and the timing has seemed to work well. So for the first hour, we do a resource fair, and I'm going to talk a little bit about that more on the next slide. But Dr. Berra knows that this disease is very complex, and it changes over the course of the journey of the disease, and people need to be familiar with resources and services that can help them through the journey. And so I'll share with you in a little bit about who we invite to the resource fair, but he feels that this is almost the most important part of the forum. And then for an hour and a half, we have expert presenters come, as well as allowing time for questions and answers, both of the congressmen and the presenters. And because Dr. Berra, as a congressman, he can kind of address a little of both, but he prefers that the experts address most of the technical questions pertaining to Alzheimer's. And then we do this in June so that we do tie it to Alzheimer's and Brain Awareness Month. The first two, I believe, were actually held in September to tie it with the walks. He wanted to promote the walks in the area. But we actually thought it would be best to move it to June because, again, even though we put a lot of volunteer time, it does require support from the Alzheimer's staff. And it put just an extra burden on them who are working so hard on making our walks successful. So let me tell you a little bit about our community resource fair. So the next slide. So over the course, the initial list of this was actually generated from the congressman's office. He's a big proponent on making sure veterans have services, and through that, he has a core group of agencies that he always depends upon. So in the first column is pretty much our core group. We always invite these folks to come, and they always have been very willing. There's no cost to it. We set up a table, they bring their resources, their materials, and their tablecloths and such, and they're there, and very interactive session with the participants. And then let me just touch upon number 12. We also invite local and other state representatives, so our local state senator or our local assemblyman to come, their offices, just again, because we know that there are state resources that are available, and also give them an opportunity to hear from their constituents about what needs are not being met. So it's a good interchange and a good opportunity to learn, again, getting back to learning and helping one another about what's working and what needs to be done next. And our second column, these are agencies that we invite depending on what the topic is. So last year we talked more about some of the basics, and so we invited and some of the prevention aspects. So we made sure that some of the silver sneaker programs, some of the gyms that were offering that program, were also present, so that they could have some interaction and tell people about their services and how to register, et cetera. In the previous year, we focused on palliative care because PCHETA was on the table at that time at the federal level, and we wanted people to understand about the legislation, but also understand about the services. And then what we talked about for our future, the 5th annual, was to also include DMV and Social Security. We also wanted to also address issues dealing with music and art therapy. So that was our plan for the 5th. And I'll tell to you a little bit about what's going to happen this year, or may not happen this year. But before I get to that, I just want to share a few lessons learned. One is that we have been able, by this partnership with the Congressman's office, is also to have access to his email listing and his ways of promoting community events. And that has been a real benefit, because in addition to reaching out to people who have already connected with the Alzheimer's Association, we are reaching out to people who probably need the Alzheimer's Association services and resources and haven't made the connection. So often we bring people who are this is their very first Alzheimer's Association event, and we think that's of a great benefit. In terms of community engagement, the resource fair brings together so many different organizations. People who provide the Meals on Wheels program is a very popular one. Building Sacramento is one that provides services like building wheelchair ramps or providing safety bars and bathrooms and such. And so really kind of covering the gamut. And this is, people are learning about things that they, worried about, and now they know that they can make a phone call and get a connection there. And then lastly, the collaborative relationship between the district staff and the congressman has been invaluable. So we do make those required district visits, but this one gives us like tenfold opportunity to communicate with the congressman's office if it's about event planning, or do you want a particular speaker, and then have an opportunity to tell another story, or for them to become more familiar with some of the needs. It's been really very helpful to share stories that we learned in the process as well with the congressman's office. And then lastly, I just want to tell you a little bit about our plans on the next slide for the 5th Annual Brain Health Forum. So we started the year with so enthusiastic. We were so excited. We were going to be going to Elk Grove, which is on the south side of the county, to their new, very fabulous senior center. It's just, oh my gosh, it's like walking into a hotel. It's just everything seniors deserve. We met with the director and some of the staff there, and just so enthusiastic. We do have Alzheimer's Association does have a support group there, but hadn't had any educational forums of any major size, and so they were so excited about bringing this to the community. We added some additional people to our planning committee who weren't part of the advocacy, but I think will become part of our advocacy team, to had special connections with various diverse community neighborhoods in the area, and just had wonderful ideas. And so we were going to be adding an exercise component and a music segment because the new senior center had those facilities there. They had a room designated for music and one for art. And we're just like, we need to take advantage of this. And they have terrific exercise programs. And so the exercise instructor volunteered to help. And so we were just all set for this fabulous milestone forum. But of course, COVID-19 entered into the situation. But we had members who had already reached out to the mayor's office, and they made a promise to do a proclamation for us. And this was all in January, as well as other types of commitments in the community. So it's all been postponed, but we are a very hopeful, enthusiastic group. So we are weighing our options. One is to do a virtual gathering, and obviously that would be one that we could certainly share information, kind of our expert panels component, but without the resource component, which, it's still going to be of great value. But let me tell you, when we polled our committee, they were like, yeah, that's nice, but we know the value of the community resource area component. And so enthusiastically, they said, why don't we try to wait till the fall and see what would be permitted at that time. We know that possibly, not all folks would be feeling comfortable coming to a large gathering. So we have discussed the addition of adding a virtual gathering or making it virtually the presentation also available, as well as providing some list of the organizations that would be present that day. And then if that doesn't work, obviously we could postpone it until 2021. So that's what we have to share today with the Brain Health Forum. And again, it's one we do in partnership, and we're very grateful to have the support of Dr. Barra and his congressional office as we provide this service through various parts of District 7. Look forward to answering any questions that you might have later. Thanks.
Barbara, thank you so much. And I think one of the strengths of this is that you're meeting the association's needs, but even more so, you're meeting the congressman's needs, and you're just a wonderful thought partner to the congressman and to his staff. Helping. You're lifting all the boats in your community with what will be the 5th annual Brain Health Forum when it happens. However it happens, it will be the 5th annual. Now I'd like to, and there's a great, I can't see the slides till I move them. So here's pictures of the congressman at the microphone, showing you the dynamic and the good energy in the room. And now I'm pleased to introduce you to our next volunteer advocate, presenter, and ambassador, Carolyn, who joins us from her classroom. Carolyn, take it away.
Yes, welcome to my virtual classroom. My son is teaching in the living room. My husband's working in the family room, so I'm relegated to the bedroom. So, but at least it's quiet. I just wanted to talk to you today about an event that we had. We did a Coffee with Congress, which is a smaller meeting with Representative Adam Schiff, who is in California District 28. And we did that back in September. When I started as the ambassador 2 or 3 years ago, the most important thing was to develop a personal relationship with his district director, a lovely woman named Ann Pfeiffer. Since then, I've also had 2 other people join the team, so we're a small but mighty team. And I know Matt Katowitz and Joe Allen Bauer are both on this call, so a shout out to them. And we have developed, the 3 of us, a personal relationship with his office. At the beginning, I asked lots of questions and tried to make personal connections, tried to find areas of common interest. And through that, I found out that that Ann Pfeiffer, Representative Schiff's district manager, in fact, went to the high school where I teach right now. So it's an all-girls school. It's been around for more than 100 years here in the Los Angeles area. So that gave us kind of an instant connection. And that's something that we fall back on a lot is that area of commonality that we have. Also found out that the congressman's own mother had Alzheimer's disease, and now his mother-in-law is also facing the same challenge. So for Congressman Schiff, Alzheimer's is important because it's a very personal story that has affected his own family. I encourage you to share your own story, without going into great details, because it does give you a connection with those that you are dealing with in the district office. And as you found out, for those of us who have been to, state advocacy days or wherever we go and we share our story, Alzheimer's has touched far greater numbers of people than we could ever have imagined. So there seems to be, everybody you talk to seems to know somebody or have some kind of a contact or been affected some way by dementia and Alzheimer's. The next slide then. This is my school. It has a beautiful view over Hollywood, and you can see I teach in the middle school, and we had students who volunteered to help us out, and we had this beautiful view looking over Hollywood as we had our Coffee with Congress back in September. Thank you, Susan. And the next slide. The Coffee with Congress is a smaller event, and it's more personal. If you decide to do something like this, the association does have a great toolkit that they can send to you that gives you all the ins and outs of what you need to do. We began laying the groundwork for this event well in advance. We ended up having our Coffee with Congress this past September, but we started talking it up at our very first district meeting in February of 2019 just to get it on the radar. I'd already chosen a location within the district. I'm fortunate that I work at this beautiful school that was more than willing to open their facilities up. And not only am I a resident of Representative Schiff's district, but my school is also in his district. And so it worked out very well. Other ideas, as Barbara mentioned, senior centers, assisted living facilities, churches. I was involved with a town hall meeting when I first joined Representative Schiff's team about 4 years ago, and it was held at a local hospital. And it worked out very well. We were in one of their conference rooms. An important thing to do is to find out the name of the scheduler. So through Ann, the district rep, I was able to find out the name of the scheduler, and Ann put us in touch. And this is the person that sets the calendar of events for our situation. Congressman Schiff schedules his events 2 months out, so we were not able to get on to his actual calendar until July. But every time we had a meeting or every email that I sent, we always had this in the back of our minds and made sure to mention it. Then we determined the most convenient time for the member of Congress, and for Congressman Schiff, the best time was in early September, so it was after Labor Day. They still hadn't gone back to Congress yet, and his own kids had gone back to school, so that was important to him that he could get his daughter settled in college, and he could get his son settled in school. So that worked out best. Again, figure out the logistics, discuss requirements for the district staff. I mean, I'm sure every district member of Congress has their own requirements. Work out things like parking, microphones, will there be a projector, how many chairs, where will the congressman sit, and then of course the all-important snacks that we all stress out about, but it's in my experience that people don't really eat as much as you think they're going to eat, so you're going to wind up with a bunch of extra food. Plus ours was in September, and we had hot coffee there on a 95-degree day, so it didn't really, our coffee didn't really go. But and then work with the Alzheimer's Association to set, with the staff to set the agenda and to arrange speakers and determine the guest list. So our policy analyst, Brianna, who's no longer with the association, she was fabulous to work with, and arranged actually to have Susan come and be one of the speakers. The association helped us with the guest list and sending invitations out. and were just pleasant to work with, did the agenda up for us. And then I ran the agenda by the district staff so they could know what to expect. And we would make changes then if changes needed to be made. Throughout this whole process, it's important to just communicate. And we communicated mostly via email because it seems to be the preferred mode for the congressman's district staff. And then, of course, after the event, follow up with a thank you, pass along any pictures that you might have, just to show how appreciative that you are. And again, a Coffee with Congress is kind of a smaller scale event, so it's more intimate. And it really allows the participants to have almost a one-on-one conversation with the member of Congress and also with association members who are present. All right, next one. Much to my surprise, maybe I shouldn't have been surprised, but a member of Congressman Schiff's team in the district reached out to me last week about a virtual event because the congressman right now is not in Washington because the House hasn't gone back. And I do follow him on social media, and I am part of his district. So I know that he's been having quite a few virtual events from LGBTQ forums. He was just on with a Muslim group a couple weeks ago, and he's been very prominent in these virtual meetings. So they reached out to me to see if they could do something with the Alzheimer's Association. And during this pandemic, because their office is closed, we've been communicating with them through email. And I'm finding out that the logistics then are different for a virtual event because they require more involvement, it appears to me, from the Alzheimer's Association than an in-person event. Because I knew the location of the Coffee with Congress and it was setting up a physical event, a lot of the details I was able to work out with the association. But for a virtual event, there's a lot of things that, such as the platform that would be used, who would be the MC, how would it go? I really am relying on the association policy analyst to help out with that, and which has been great because they've been very responsive. And then we're in the process right now, and I think Daniel's on this call too. But I know that I connected the district representative with the public policy manager from the association, and hopefully they are able to connect and get something worked out. So this all just happened on Friday of last week. And then to yet to be determined would be who to invite. I would imagine between the congressman's mailing list and email list and the association's database, we'd be able to determine an audience. And then again, how to screen calls. And I think the association, Daniel, is working on getting that. So there's still a lot of unknowns. Because I've never done something like this before, and we are in the process of working on this now. And I think that's it, Susan.
Thank you. And you're not the only one that's never done this before. None of us have, unless you lived through the Spanish flu and you're on the phone. I don't think any of us have experience. So I just want to commend you for being flexible and nimble and, looking at an alternative to something that was clearly successful the first time, so successful that the congressman reached out to you to try and do it differently this year. That's really a credit to you and to your team that it was a beneficial gathering for everybody. And I got to see that pretty view that day too. It was. And it was really nice to have young people involved too, and that's another something to consider is including students. I think that really, the congressman really appreciated it that day. So now we're going to hear from Mark White, and we're going to Mark joins us, and I think this picture tells the story, but we're going to go until about 12:50, and then we're going to allow time for questions. So Mark, please take it away.
Well, good morning, everybody. I was asked to talk about how to address and get in front of the microphone. I started by getting an invitation or finding out somehow that Mrs. Matsui, she's the congresswoman on whose Alzheimer's team I'm the lead, was having an event, press event. I went over there and stood in the background, and as the event was ending, I did the 6-year-old trick of starting to move up near the front of the adults, in front of the electeds and the appointeds. And as the event was just about to end, I stood in front of the microphone and made some statement about whatever she was talking about that day and tied the word Alzheimer's into it and how it connected. I did that again a couple more times. I think the third or fourth time she invited me. And the same thing happened that time. Of course, I'm not a speaker. I'm not one of the noted speakers, and I don't come with the kind of expertise that Barbara Marquez brings. She's got significant health expertise and has a platform to speak from. I'm only somebody who's lived with an Alzheimer's patient. But when I get up there, as I said, I try to keep the remarks to a couple minutes maximum. I always focus on the Congresswoman's agenda, and I always use the word Alzheimer's somewhere in my comments. I went to another meeting that Susan asked me to go to of a very large group of seniors that was held in the spring outside the south steps of the Capitol. It was cold. It was really not the best day at all to be outside, but we had a bunch of legislators and several of the governor's staff speaking. I asked questions of the legislators in the meeting, but the other thing I did that I think has worked out well for me is I walked them to the steps of the Capitol and put my pitch in for the 2 pieces of legislation that the association had before the state legislature that year. One of the governor's people is a guy who's about 6'5" or 6'8" who made a presentation. I had a question or two for him. I also walked him toward the Capitol. But then Susan asked me to go to another meeting, a Native American health facility meeting at which the governor was speaking and at which I was clearly uninvited. I snuck in the back door, kind of hid amongst the staff, and got caught. And the security was about to walk me out until I noticed this 6'8" guy and waved at him. And he said, "Oh, that's okay. He can stay. He's okay." So I stayed and did the 6-year-old trick again and walked up and made the last comment of the questions to the governor and just thanked him for his focus on Alzheimer's and his focus on assisting seniors with a lot of their issues. Now, if I were to do it again, I shouldn't say that. Now, when I do it again, and I will, I always wear my Alzheimer's shirt, this one or a long sleeve shirt. I always, as I said, get the Alzheimer's comment in there. But now I think we need to be also talking about the impact of this COVID quarantine on Alzheimer's patients and caregivers. And so we need to make sure that that statement is wrapped into whatever we have to say to anybody. Everybody can do this. When I started, I wasn't really shy, but I wasn't willing to step out of my sphere of comfort either. I don't care now. I'm going to get up there and I'm going to say what I'm going to say. And I know that whatever I have to say will not make it on any kind of televised event at all, but I may be able to influence some of those people in the audience. And that's what I'm up here for now. I think that's all.
Mark, thank you so much. I've seen you in action, and I wanted everyone to hear from Mark too, because the models that we heard from Barbara and Carolyn are outstanding, and what they had in common is a lot of advanced planning, a lot of coordination and communication, and we know that's not always possible. Maybe the team isn't large enough, maybe the member of Congress or state legislator isn't a willing participant, maybe the resources don't exist. So I really wanted you to hear from Mark too, that you can make a similar impact extemporaneously. And I think in this virtual environment, when so many are holding their own town halls on COVID and other topics, that's an opportunity from our own homes. We can call in or access by video. and insert the word Alzheimer's, share a bit about our personal stories, and make the link to COVID. So Mark, thanks for showing us the way and being such a great example. And I understand questions have been answered in the chat, but at this point, if anybody has anything they want to share or ask any of our presenters, Kate, Barbara, Carolyn, or Mark, have at it until the top of the hour. And Nicole's going to moderate the questions from here.
Thanks, Susan. I don't see any coming in at this moment, but we'll give it maybe a minute and see if we have any.
And while we're waiting on that, I just again want to thank all 4 of our presenters for agreeing to do this today, for taking the time to prepare their remarks and their slides, and most of all, thanking them for what they do the other 364 days of the year when they're not on webinars to advance our federal and state priorities and to help us make an impact for everyone who's suffering from Alzheimer's in Arizona, Hawaii, Nevada, California, and the rest of the nation. Any questions before we wrap?
No questions, Susan. I think that's a wrap. Everyone, we have a lot of compliments coming in, and thank yous to the presenters. Very appreciative for today's topic, and wonderful job.
Great. And next week, I think we're going to focus on Alzheimer's and Brain Awareness Month. Is that right, Nicole?
That is correct. We're looking forward to talking about what our plan is for next week, or for next month, rather, for Alzheimer's and Brain Awareness Month. So we look forward to seeing everyone and hearing from everyone next week.
Great. Thanks for joining us today. Have a good afternoon, everybody.